So I first became familiar with the continuing care sector when my grandmother transitioned from supportive living to long-term care. Realized what an important time it is in someone's life and the capacity that the staff have for quality of life. I also realized the impact that my family's resources had. We were able to visit often and to support my grandmother in participating in programs and activities outside of the care facility that not every resident had. And being someone who's concerned about health policy and equity, realized that no matter how many family members they have available or the resources at their disposal, that they could participate in a full range of activities and really get a lot out of that time in continuing care. My research broadly looks at care for older adults. I look a lot at rural long-term care, so that's one of the studies that I'm involved with, and the other one looks at sexual expression in continuing care homes.
Julia came out to a staff meeting one day, and she introduced herself to my staff, introduced her project. The project that Dr. Brassolotto proposed to us had to do with best practice in long-term care, and we are always looking to do what we can do to make our seniors' lives easier and better and give them more quality of life. So we were hoping through helping her with her research and looking at the recommendations that she would later make that we could use those best practices that she came up with and incorporate them into our practice. During the research, she had 2 researchers here for 16 hours a day for 7 days during 1 week. So they got a really good feel for what goes on in the facility. They also talked with residents in the community that came in to visit and tried to determine what the impact of having a long-term care had on the community as a whole. Their research, I felt, was very thorough and came up with some really good ideas. And I'm hoping to see that those recommendations go right to the policy-making people in Alberta. Because if we can get some resources behind what some of those recommendations are, we can improve quality of life for our seniors. And we can make these facilities more like homes than like a facility.
Our community partners are incredible. Pretty much anyone who I've approached about research has been willing to be involved, has helped with recruitment, has helped with dissemination of our findings, and that's priceless because we have people who are excited about research and excited to share it. If we're looking at long-term care, a lot of people imagine it as care for particular generations or cohorts and not thinking of the fact that it's likely their parents or their parents' friends or their aunts and uncles and themselves and their friends in cohort will need those services too. So it's not for a distinct population that's out there. All of us, if we are lucky enough to get older, will have the opportunity to use those services.